Use of oral prednisolone to prevent progression of valvular disease and development of rheumatic heart disease in acute rheumatic carditis, a randomised controlled trial.
The aim of this research project is to assess the effectiveness of the oral corticosteroid prednisolone versus placebo in preventing the progression of valvular disease and hence the development of rheumatic heart disease in those patients diagnosed with acute rheumatic carditis. We hypothesise that the use of oral prednisolone in patients diagnosed with acute carditis in the context of their initial diagnosis with acute rheumatic fever will reduce the likelihood of these patients developing valvular lesions, the progression in severity of existing lesions at the time of diagnosis, and the development of rheumatic heart disease.
Previous studies, most of which were conducted in the 1950s, have found no benefit in cardiac outcomes with the use of corticosteroids. The small size, antiquity and poor quality of most of the trials restricted assessment of clinical outcomes by current standards. Advances in echocardiography will allow more objective and precise assessment of cardiac outcomes. Once randomly allocated to a group, local Indigenous liaison staff will educate the child and their carers on how to take their allocated medication, including the duration. Participants will be selected from the WA Acute Rheumatic Fever Register. The inclusion criteria is patients between the ages of 5 to 14 diagnosed with rheumatic carditis whom identifies Aboriginal and Torres Strait Islander, and time to treat is within 28 days of diagnosis. Severity of valve disease will be presented over time and be classified as progressed, unchanged or improved over the duration of the study. The percentage of participants whom progressed across severity increments, including the percentage of whom developed rheumatic heart disease, and the rate at which the progression occurred will be highlighted. Indigenous West Australians with rheumatic heart disease die on average at the age of 40. Children must travel away from family and community for heart surgery, and young adults live with premature disability. There's also reduced social and economical functional capacity due to poor health leading to reduced unemployment, and an increased burden on the health sector, with valve replacement a common outcome.